Hello then to Nick.
And I am Helena, and we both work at the MS Trust, a charity for people affected by MS in the UK. We are here to help you make sense of MS.
Yeah, thank you so much for listening to our podcast. So this is Multiple Sclerosis, breaking it down. And today we're actually going to be tackling breathing issues and MS.
Yes, and this might seem like a bit of a scary subject to talk about. And it's something that's mostly associated with quite advanced MS. But we thought it was important to talk about it. It's often not talked about unless it's like a big problem that occurs. But there are some things that you can do like here and now to try and prevent it from happening in the future. So we thought, why not actually talk about it and sort of raise some awareness about it.
Yeah, and I think when we first sort of put it out to the MS community, Helena, when we were sort of talking about breathing problems for our social media, I was shocked by like so many people got in contact saying, "Oh, well,
Yeah.
that happens to me too. That happens to me. I never knew this could be part of MS." So it's clearly something that people experience, and maybe it's as you talked about enough. So, we're going to be talking about all the different aspects of it. So not just exclusively things that are found in advanced or progressive MS, but also things that might evolve earlier on in the MS journey, or things that as well, breathing issues that might result because of an infection.
And I guess we should say here early on that if you would happen to have a sudden onset of breathing difficulties or shortness of breath, you should go and see a doctor or go to the A&E because not everything is MS and it can be a sort of a serious thing. So there is breathing problems that could be associated with MS, and there are acute things, and they should be taken seriously.
Yeah, absolutely. I mean, it's really can be a really, really scary topic, can't
Absolutely.
it? If you're ever in doubt, it's so important, isn't it, to go and get yourself checked out. And we've got a couple of experts who are going to be joining us shortly. So we've got Rachael Moses, who is a consultant respiratory physiotherapist. And we're very excited because she's just become one of our MS Trust ambassadors. So it's very exciting. We were really happy to welcome Rachael on board. She's going to be such a great asset to the team. She's got so much experience, and she's just really easy to talk to and listen to, and gets her points across really well. So we're really excited to have her on board. So Rachael will be not only talking about the subject, but also answering lots of your questions that you sent in. As I said, we were really sort of blown away by how many people were experiencing breathing difficulties that could be linked to MS. And when we put the call out, there's so many people got in touch. So we've taken as many questions as we could and put some of them to the experts. So I'm looking forward to hearing that.
Yeah, I was also really shocked because I think, we thought how many people will put in up some questions, because we put up other topics where we thought we could get lots of questions, but it's not been as many. And then we weren't expecting quite this onslaught of questions, but that makes it really interesting. Joining Rachael is a friend of the podcast, Neuro physio Jody Barber. She's been here before talking about mobility tools and things like that. And she's helped us out a lot over the years with content for our website as well, and spoken at conference. And she's a proper MS Trust friend as well. And both of them, both Jody and Rachael, are super passionate to talk about breathing issues and MS. So I think, like Nick said, we met them at conference, and they were both so sort of just, you could see that they really wanted to talk more about this topic. So I was really excited to have them on the podcast.
Yeah, definitely. We've got the real sort of MS Trust team today for this one, haven't we? So no, they're both fantastic. I'm really looking forward to hearing the whole interview. So I think we can probably jump in now. So this is going to be Helena, Rachael Moses, and Jody Barber. Enjoy.
I'm here today with Rachael Moses, who is a consultant respiratory physiotherapist, and Jody Barber, who's been on the podcast before, who is a highly specialist neurological physiotherapist. And earlier in the year, we caught up with Rachael and Jody at the MS Trust conference, where they just stepped down from the scene talking about breathing problems in MS in front of a bunch of MS health professionals. And we started chatting about that, how often this is actually a forgotten about symptoms, that, we don't hear much about this. And we sort of said, it's often just discussed as a part of really advanced MS. So we started talking, maybe we should do a podcast. And there was that a resounding yes in the room. So I'm so pleased to have you both here today. Before we start, could you just briefly tell us who you are and what it is you do? Just very short, so people know which one is which.
Hi, everyone. So my name is Rachael. So I'm a physiotherapist like Jody, and I specialize in respiratory health. So I look after people with a variety of long-term conditions, which result in their breathing being more difficult. And yes, I work in a regional team. I love it. And I also work in a leadership role at NHS England.
So hi, I'm Jody Barber. I'm also a physiotherapist, as Rachael said, and I've had a special interest in helping people with MS live well with their condition for over 30 years, and worked in the NHS for 33 of those years, and now work in a specialist charity helping people with MS and more recently other progressive neurological conditions. And I've had a long passion of raising awareness on this topic. So thank you so much for inviting me.
Very excited to talk to you both. I just want to say before we start that we were planning on having a speech and language therapist in this podcast as well, but they sadly couldn't make it. So we haven't given up on the idea, because we know how important they are, especially when it comes to breathing issues. So we're going to catch up with them a bit later in the year for another special podcast about that. But shall we start then? So I'm going to just throw it out, because what is breathing problems in MS and how can they manifest? Rachael, what do you say?
So many of you listening to the podcast will know that MS is primarily a disorder of the central nervous system. So the nerves become affected, which in turn affect the muscles. And people with MS can develop, especially over time, muscle weakness. Now, that can include the muscles of breathing, like any other muscle. But breathing is such a subconscious activity. So you're all breathing now, and you don't really have to think about it too much. But when the muscles of breathing become affected, so this can be because of weakness or dysfunction, or sometimes the nerve signals don't work in the right way, we can start to develop symptoms. And sometimes these symptoms can come on when we're doing more activities that require more effort, such as if we're running to catch the bus or if we're climbing stairs. But sometimes as well, the breathing become more difficult, just sitting, watching the television. So in terms of how do we kind of define respiratory or breathing problems in people with MS, it can actually present and manifest in many different ways. Sometimes it can be a progressive, something that comes on over time. Sometimes it can be very acute, and you might notice things like chest infections, or at certain times of the day you become more breathless or doing activities. And sometimes it can be dysfunction, which we'll talk a little bit about. So getting dysfunctional breathing patterns or feeling you can't catch your breath. It doesn't happen for everyone, but we know people in the more advanced stages of MS, it can be a real anxiety. It can be a real struggle for people, because being breathless at rest, is hard work. So that's something one of the reasons why we're so happy to talk about it today.
And how common is it? I mean, you mentioned advanced MS, but could this also be something that could even be an early sign of MS?
I wouldn't call respiratory. It's not necessarily an early reported sign of MS in my experience, but as I said, I've long had a passion of increasing our awareness and understanding, not only as healthcare professionals, but also people living with MS, is because often you're admitted to hospital with a urinary tract infection. That's the most common reason to be admitted to hospital, or to need additional help, or to feel really poorly. But the second most common reason is chest infections, what we call respiratory illness. And that can lead you to either become very, very poorly, and that can have an impact on your ability to carry out your everyday activities, need antibiotics being prescribed, or it could lead to a hospital admission, and it can take a long time for you to get over that. So yeah, second after urinary tract infections, but we seem to have a lot more awareness about managing our bladder a
Yeah.
few years ago than we did about what our breathing. Because what my experience as a clinician, I would find that person would I'd find out they'd been admitted to hospital, for example, and they were like, but I didn't know there was anything wrong with my chest. So it's like a silent symptom that, and then when you deeper dive into that person, you go, well, kind of it was there as a silent kind of the first sort of, sort of quite kind of snotty, chesty cold that then sits on someone's chest, and then that kind of manifests as an infection. So so it's common, but it's often that silent kind of hidden symptom that people might not be aware that it's a problem. Whereas with your bladder, you may be aware that you're making frequent trips to the toilet, that things aren't quite right there. With the breathing, it's a little bit kind of hidden away until you get a nasty cold that then you don't get better from in the normal way.
Gotcha. So is there any way we can sort of measure it or almost check it ourselves if you say it's like a silent kind of thing, so we can work it out whether there is maybe something going on there?
Well, essentially the answer to that is yes. There are ways that we can monitor lung function and lung health, but generally speaking, that tends to happen if someone has a known respiratory problem. You might have heard of things like COPD, which is an obstructive inflammatory disease of the airways, or other conditions. So as professionals, if we're worried about someone's respiratory health, and like Jody said, is if it's something that's been creeping up on someone for a long time, but actually they have a hospital admission, someone starts asking questions. For example, are you short of breath at rest? Is your cough weak? How many times have you needed antibiotics for your chest in the last 12 months? And other questions, someone might put the pieces together. So there's techniques that we can use as healthcare professionals. So that might be blowing into a tube that measures your lung function. It's called a peak flow meter that can measure the amount of air you have in one breath. And it can also measure your cough strength. But there's also more sophisticated tests you can have done either at the GP surgery or in a lung function laboratory, which are non-invasive, so they're simple to do, but do require like a maximal effort. So we can monitor, but there is things that you can do to just really be more aware of your own like lung capacity. So we've already mentioned things like, speaking. So we're speaking today in full sentences. Some people might have to take a breath every couple of words. If your cough strength gets reduced, which can often be a sign people don't put together with breathing. So if you're constantly trying to clear your chest, or if someone says, can you just do a big cough? Because they can hear something rattling on your chest, but you just can't seem to get the breath to make that big cough. That's another sign. There are other signs such as being able to blow your nose and sneezing. And I know that keeps coming up, why can't I clear my chest or clear my nose? So there's other little signs. And if anyone's sat wondering at home, just simple things like, can you count to 10 without taking a breath? How long can you hold your breath for? And sometimes people just keep a little diary of certain things that make them feel breathless, because we would associate certain things like, I mentioned running to the pubs or climbing the stairs, but actually, if you're finding certain activities of daily living, putting your clothes on, tying your shoelaces, people can really struggle with because it squashes the big muscle of breathing. And sleep quality, fatigue, these all play a massive part in your lung health. So that was probably a really long answer to what you might have thought was a simple question.
Well, it's not a simple issue, is it? So it's probably fair enough to say that. But I guess it's just all these little bits to look after then. Are there any other signs that we should look after?
Yeah,
Jody?
so it's quite interesting. As a physiotherapist, you specialise in your area, and as we know, Rachel's a respiratory consultant, specialist physiotherapist, and I've specialised in neurology. But Rachel said to me at conference that, you have to be a generalist in all of these areas with MS, because it can affect anywhere. And so what often happened was the neurophysiotherapists it wasn't something we were actively questioning, the people with MS about early on enough. And so we did do quite a few years ago, 3 centres had a deeper dive into just questioning and asking some questions about our people with MS that were coming in. And what we discovered was what we didn't know is when exactly is there a point when we would expect respiratory health people to be more vulnerable and stuff, and we still don't absolutely know that answer, but we've got some really useful facts and information that we can use to kind of really think, well, this is the time to be really thinking about our respiratory health a bit more, because there's a lot to juggle when you're living with MS, and like what do I concentrate on? It can be a bit overwhelming. So what we noticed was that, and what I suspected was the point at which someone had to start using 2 things to hold to support themselves. Then when you hold on to something, you immediately have to splint a lot of your muscles here. And so then it can be harder to take a deep breath. And we wondered, was that the time, or is it when you're having to use a wheelchair a lot more? So what we did find out was, and it is supported by certain studies, that when your upper limb function, your arm function starts to deteriorate and you get weaker in your arms, and that can just be finger function. It doesn't have to be whole arm movement. That's associated with a decline in how hard you can and fast you can blow out. Also, we found a close link to putting on weight around the middle of your body, and also low back pain. And that makes, because things are squashing on your lungs. And also if you're in pain, then you're less likely to take a deep breath.
Yeah.
So it's just, so in answer, the other things you might want to be asking your healthcare professional, or taking maybe a bit more of a look, as Rachel said, taking a bit of a note of are things changing, particularly if you've noticed some things are changing in your hands. If you have got low back pain and you put on a bit more weight, that's also going to make things a little bit harder as well. And they're not definitive. It's just things to look out for, because everyone's so individual in what's going on, and it's not kind of ABC, if you know what I mean, in terms of this will happen and that will happen necessarily. And again, it's a really long answer like Rachel's. So in terms of measuring it, I encourage people to just understand what the peak cough flow is like, because it's an easy measure when they're healthy. And then ideally we're recommending as neurological therapists that we just check that at the annual review as a general health test, like you'd have your blood pressure checked and things, so that you know what you're like when you're kind of healthy and you're good. And then it's earlier to detect if there's a change that starts to happen. For someone through the course of their life with MS, it might stay the same all the way through their life. But it's helpful to know when there's a change. So definitely, if you become more sedentary and your arms get weaker, back pain, and putting on a bit more weight around the middle.
It's interesting what you're saying about peak flow meter, because I have 2 asthmatic sons and they get those, and I kind of thought I've never had to go at one. So I was using one that they had ordered from Amazon, and it's quite interesting to sort of see where you're at. And then I've been out running and I was seeing whether it improved it. And but is there any sort of measurement that we know that is average with this? Or because I'm just thinking, if somebody gets one, blows into it, and then sort of say, well, what does that number tell me?
So I think that's a really great question, first of all, Helena. And so the peak flow meters that asthmatics, as you mentioned, have at home, they measure, they're more a forceful effort over one breath, which measures the level of obstruction. So you have what someone would have a normal. So when, say, your son is normal and feeling as fit as they are, he will have that normal value. if he's starting to exacerbate, that number will drop. And if it drops by a certain percentage, that's when he might need certain medications in his asthma plan. So with neuromuscular disease, it's very different. So that's with a condition that affects the obstruction of the lungs. With muscle weakness, which people with MS have, obviously forgetting about any other respiratory conditions they might have, it's very different. So what Jody's mentioned is a specific technique using that peak flow meter that helps to monitor over time, which is slightly different.
Okay.
So we wouldn't really advocate people going out and buying these themselves. It would be something that, because it's about technique, it's about the type of interface you have. So if you blow into a tube, if you have a mask, and as Jody mentioned, we actually adapt the use of these peak flow meters for what they're designed to use, which is in asthma monitoring, to measure cough strength, which is actually probably more of a concern when the respiratory muscles get weak, because that's when you get the chest infections over actually the volume someone breathes, because we know people over time can adapt to really low lung volumes and actually be okay. They're not affected by it. So yeah, great question, but that's why we don't advocate for people to just go out and buy these things and maybe see, like a professional.
Well, that makes sense, because that kind of shows that all respiratory issues are not treated equally, are they? So if you're having issues with something that you may think is related to your MS and it's respiratory, who should you contact? Who should you talk to?
Well, again, another great question. So as Jody mentioned, MS professionals, I have, as a respiratory clinician, I have so much respect, because MS specialists or specialist in MS, neurological conditions, but actually that includes all the other systems that someone has. So we always say, contact your MS professional. So for some people, that might be your doctor, a consultant, it might be the nurse, it might be the physio, the occupational therapist, whoever you have that relationship with, and as Jody mentioned, who might perform your annual review, as they will help to be able to differentiate between what is something that's related more to your MS condition. So for example, those people who have relapse and remitting, or those people who are maybe more in more advanced stages of MS, or more progressive MS, and they'll be really help you to give you tips and techniques to help maintain activity, which is a really important part of respiratory health, but also some of the red flags that we might have. And I'll talk about the red flags which would trigger a respiratory referral. But I also want to make the point that people with MS can also have respiratory conditions, as I mentioned before. So if you have ever been a smoker and you're getting a bit older, even if you give up 10 years ago, 15 years ago, there's checks that you should have to measure if you have COPD, chronic obstructive pulmonary disease, because that can manifest in later life. If you do smoke, we really do advise you try and get help to stop. Obesity is a really important factor in respiratory health, because it not just affects your breathing through the day, but also at nighttime. But as you become less active, it becomes harder to maybe control your weight for some people. But also there's other conditions that develop over time. And what a respiratory team will do is just give you that kind of lung health check. Now, some of the red flags, so if you were coming to Jody or myself and you would be saying things like, I just can't get my breath. I just can't take a deep breath. I really try, but I just can't get that air in. I can't lie flat anymore. So that's a real red flag for us, because it means that the big muscle of breathing, the diaphragm, really struggles when the stomach contents, like Jody says, are pushed up. I can't cough, or my cough's really weak. I sit sometimes and I get short of breath just sitting, and I don't know why. Sometimes it's chest infection. So I have had to go to the GP 3 times already this year to get antibiotics in my chest. And if you have a combination of all of them, that can really be a sign to us that actually you need a specialist respiratory review. Now, I say this like it's really easy to get a respiratory appointment, because sometimes it can be really challenging. But if someone puts on a referral to a respiratory things, all of those things combined with a diagnosis of MS, really that should trigger a specialist respiratory referral. And normally that's to a respiratory consultant, first of all, who will triage. And they might refer you on to a physiotherapist. They may refer you on to a speech and language therapist. They may refer you on to a number of people to have some certain tests done that can really help to either diagnose a respiratory condition or exclude, which is just as important, saying actually your lungs are okay. And it's not always about getting a chest x-ray, because 9 times out of 10, unless you've got something going on within the lungs themselves, we know normally this is because of the muscles that support the lungs.
That makes sense. But I guess also if you're having acute problems, you should be going to A&E, right?
Absolutely. If you experience sudden onset shortness of breath, yes, definitely. You know, if you're looking at someone, your loved one, and they're looking a bit blue around the edges, or they really can't talk, then absolutely that's an ambulance call.
Are there preventative things like exercises that people with MS can do themselves? I know during COVID times there were all talks about singing and kazoos and all sorts of exciting things. Is this still the same?
Well, yeah, there's loads, and Rachel's said, so generally, if you're living with MS or any long-term neurological condition, we're always interested in our overall health, our brain health, and our kind of physical, what we call our muscle, what they call in musculoskeletal health, the muscles and the bones. So general exercise where you get out of breath is very beneficial, not only for your breathing muscles, for your lungs, but also for building a bit of what we call neuroprotection and helping keep our brains healthy, helping and making sure the volume of our brain stays big. So hopefully, if you're given this kind of advice at the point of diagnosis, you're already engaged in some form of regular exercise, but that's not always easy because we're human beings, that we have other things that distract us, and also with MS you can have relapses and symptoms that come along that make exercising hard. So doing a form of exercise that makes you feel out of breath regularly. So the kind of national guidelines depend on how vigorous you're exercising. So I would say half an hour of something moderate walking every day, or 3 times a week where you get seriously out of breath. And do something that you enjoy. So that could be dancing, that could be running, that could be boxing. There's a lady who she loves boxing. There's quite a lot of evidence around high intensity exercises, anything moving around that just gets you out of breath. But sometimes there are times when you can find getting out of breath is really difficult because you've become weaker, you've got pain or whatever. So always seeing people to have that kind of pain managed and all of those things to enable you to exercise. And then, yes, we talked about singing. Singing can be a really lovely way to really exercise that big muscle for breathing, your diaphragm. So I really recommend joining an online singing group. It doesn't have to be a choir. There are lots of singing groups, or a face-to-face singing group. You don't have to be entering to do any sort of performing, or you could just sing along to your favorite songs at home. I love doing that. And sing at the top of your lungs, your heart. And when you have the respiratory podcast, so we have to talk about the importance of keeping the muscles around the throat and that strong as well. Singing can help with that. So yeah, general exercise, singing, but do something that you enjoy. I don't want to tip on kind of speech and language, because it's a speech and language therapist that taught me about, humming with a kazoo can be really good for exercising the muscles around, particularly around your throat, for talking and coughing and things like that. So, kazoo playing can be helpful. Playing a wind instrument, if you do already, all of that, keep it up. It's all really, really helpful, but a little bit more kind of niche to that area, and might help a little bit more. Or you might notice this is where I'm coming out of my area of expertise. We talk about dysfunctional breathing and things like that. but you might notice if there's a problem. Say you're playing the flute and you can't play anymore. I don't know. You might notice there's something there. So general exercises. There are specific breathing exercises that you can do to really give your lungs a good stretch. And this is something that Rachael taught us when we asked her for some help about educating us as neurophysios to do. So reminding us really, so stacking your breath, and then which is where you're taking a breath in three stages to really give those lungs a full stretch. And then there are supportive things that can be used if you find that hard. So to help give you an extra deep breath, so there are bags that can give an extra big breath. Now they can be assessed for and issued by your respiratory physio, but a lot of neurophysios also are trained in use of the adjuncts that can help with taking a deep breath when you're finding that a little bit harder. But that should be done at your annual review, or if you've contacted, and it's just it's different in different areas who you will navigate to. But that's for your specialist healthcare professional to navigate with you what's the best thing. However, it doesn't mean that the other things aren't going to be helpful. So if you're still finding it hard, so I've got people here at the centre where I work who have very quiet voices, who come to the singing group here because there's a lot of other benefits from exercise, and then also have support as well. Yeah. So it's just not one thing fits all. I don't know if that answers it, but
I love that, because we often talk about like brain health and how good it is to learn a new skill. So if you, for instance, decided to learn to play the flute, I mean, you're doing 2 in 1 there, aren't you? You're learning a new skill and you're doing breathing exercises. And why not start doing a bit of karaoke maybe there? I know that there are even apps where you can go and just sing, and you kind of do online karaoke, so you don't have to be at the, I was going to say smoky bar. Hopefully bars are not smoky anymore, but but yeah, I mean, it sounds like there's a lot of stuff that could be fun as well. So you wouldn't actually feel like, oh, I'm doing exercises now. So I think that
the kind of real message here is it can be really hard to exercise if you're living with a long-term condition like MS. It can be very soul destroying because you're not living in the body that you hoped you would have, and it might be failing you at different times. Or there's that unpredictability that it might be good one day and not another day. And I think it's knowing what you can do on those not so good moments or periods, or not so good kind of days, and knowing that even like a little bit of singing, if you can't do your normal run, to kind of just really exercise things, and do something that you do enjoy, because you're more likely to attend to that exercise, keep it up if you enjoy it. So I'm trying to think of an exercise I don't enjoy. I quite like exercise, but there are things I don't enjoy. I don't enjoy racket sports, so I don't do those. So,
but it gives me a good excuse when I'm singing along in the car, or when I'm cooking and my kids are complaining about my singing, to say, well, Mummy is actually exercising now, so leave me be.
Because how often do you, if you don't ever sing, do you project your voice, unless you're a shouting type of person? I don't know.
When we were talking, we're told the community that we're doing this podcast, we had loads of questions. So would it be all right if I ask a few of those ones that we have sent in to us? This first one actually sort of almost came about when we were doing the podcast about sleep problems. And somebody said, waking up in the middle of the night, out of breath, could this be a sign of MS breathing difficulties?
Yeah, so broken sleep can be caused by a number of different things. And we know that insomnia can be a real challenge for people with MS. But what we're talking about here, this question, is being woken up in the middle of the night when you're presumably in a deep sleep and feeling panicked because you're short of breath. So for people who have a condition that affects their muscles and muscle weakness, sometimes the big muscle of breathing, the diaphragm, can become affected. And the diaphragm is a huge muscle, and it's very resilient, and people can function really well with really small percentages of the diaphragm function. But during sleep, if you've had the fortune to sleep with anyone or share a bed, you'll notice that as people go into the kind of deeper stages of sleep, their breathing rate slows down and their breaths gets bigger. But when the muscles are weak, especially the muscles of breathing, the body just can't do that anymore. So what you find is when you go into that deep, deep sleep, your brain is a very clever thing, and it will recognize that your breathing is becoming insufficient at night, and it will therefore wake you up because of certain, without going into too much detail, with certain things that happen with different chemicals. And people who wake up in the middle of the night experiencing this breathlessness, it can be a sign that the muscles of breathing are becoming weaker, and they might be disproportionately weaker than, say, your body muscles, like Jody mentioned. So yes, do get it checked out. What does it mean? Well, it can, again, a respiratory team will put the pieces together. So for example, if you have maybe another condition, or if you are carrying a bit more weight around your tummy, you might have a condition called obstructive sleep apnea, which people can get when they don't have any other conditions. And there's very simple checklists you can do. For example, the size of someone's neck, the age, your weight. Particularly if your partner notices you're snoring, or if you've been married a long time, your spouse may sleep in a different bed because of your snoring. So there's all these different signs. But yes, in short, yes, it should be something you get checked out. Sometimes people adapt, so they might have previously slept with one pillow, they're now sleeping with 2 or 3. Again, that can mean different things. But also, it's not just about respiratory, there can be cardiac signs of that as well. So it's definitely worth mentioning. And that's something you can go to your GP about. Obviously, speak to your MS team. But that's something that if you're having those types of symptoms, and you maybe can't get an MS review quicker, go to your GP and just say, these are some of the things that I'm experiencing. And it may be that they refer you on to someone based on some of the things that are going on. A simple blood test might show different things. So it might be something that, it might be something you don't need to worry about at all. It might be something that actually needs a bit more attention because there's other things going on. So, yes. And, things like nightmares, people who all of a sudden have vivid dreams that you never had before, waking up in the morning with a headache. These can all be other signs when professionals start asking you all these questions and you're like, oh yeah, I have that as well, and I have that as well. So it's starting to piece it together.
So the next question was, a crackly chest sounds like a smoker, rattles and wheezing. Could this be linked to MS? There was blocked nasal passages on the right-hand side. Could this be linked to MS? And there was a lot of people talking about chest infections and ongoing chest infections that weren't going away. So that clearly was a bit of a theme here.
I don't mind answering this one as well. So, this can be related to overall lung health. It can be related to your ability to take that deep breath. So if you imagine you're only ever breathing from the top part of your lungs, you've got all the bottom bit and the back bits that aren't getting any airflow through, and then lungs are a breeding ground for infection. So you have lots of mucus in your chest, you have lots of saliva. If everything's becoming a little bit discoordinated, if you notice maybe you drink certain fluids and you're maybe coughing a little bit, there might be a little bit of swallow dysfunction there. All of these different things can lead to maybe not so much an increase in mucus or sputum, but it can mean more of an inability to manage it. That means clearing the bottom part of your lungs. And sometimes it's the saliva that we normally have in our mouth, and obviously in our nose, we sneeze to get rid of. We blow our noses, especially, in certain times of the year. So if we have a cold, if you have catarrh, so there's all these different factors that can come into play. If you're feeling like people are telling you have crackles, that's normally just saliva that's sitting around your vocal cords, which sit right up here at the top of your what we call your airway, at the back of your throat. And that sometimes you just don't have the strength to clear. So there is certain techniques that your physiotherapist, your speech and language therapist can teach you to help give you a bit more puff. Jody mentioned the air stacking, but also things like really good oral health. So after, taking time with your food, maybe trying different consistencies of food. The speech and language therapist will talk about certain foods that would trigger more saliva or more mucus, like cough. And then there's other things you can do if you do feel like you're very congested, or if you live in an area with a very high pollen count or very high congestion, a lot of exhaust fumes, just doing simple things like nasal rinses. So you can get little contraptions off the internet. You can get little teapots that you just basically rinse your nasal passages that can help get rid of any of that congestion, which people can find really helpful. But this kind of phlegm sitting on the chest, if you can feel it here, it's mucus in the lungs that you may just have trouble coughing and clearing. If it's more, you can hear it, is kind of the throat, and that's when your good kind of oral health or hygiene comes in. And being maybe more mindful of the consistencies of food. But really, this is when we're kind of getting into the speech and language therapy threshold to make sure that there's, the swallow and the protective mechanisms are good. And then there's certain techniques they can teach you. So, make sure you're sitting upright as you can when you're eating and drinking, making sure that, you're more mindful of when you're coughing, if there's certain things that are triggering that cough, particularly if you're eating. And yeah, speaking to your MS professional.
Brilliant. Shortness of breath. Many people mentioned shortness of breath, not just when exercising, but just at random times. And some people asked if this was linked to the MS hug. When you were talking about pain, I do remember when I had the MS hug, it was really hard to take a proper breath. That's probably how I noticed the MS hug in the first place, because I stood up at the stairs and tried to, and it just felt like something was stabbing me. But people find this really, really stressful, and sort of they get filled with anxiety. Is this linked to MS?
So, as I said, everyone's symptoms and how they're expressed, how they manage are very individual. So I don't want to give a kind of blanket this yet. And your personal experience of you very kindly shared, Helena, explains, yes, you found it harder to kind of maybe take a fuller breath with that MS hug. And the MS hug is something that is really anxiety provoking. It's one of those really hard, invisible symptoms for people to describe. And I'll be honest, even as a healthcare professional, I don't really know what, do you know what I mean? People describe it, and it's very all-consuming when you have it. And it's really hard for me to understand what that feels like. But it's very round here. We've got all our organs that we want to protect and things. So I would imagine there's quite a lot of nerve ending. I know there's quite a lot of nerve endings there, so it will feel really quite bizarre and quite horrible. So naturally, taking a deeper breath is going to be harder. So the question was shortness of breath, not when exercising at random times. It could be linked to the MS hug. And I would say that the random times, yeah, but again, as Rachel's echoed, I'll echo what Rachel said throughout this. Talk to your MS healthcare professional that knows you well to work through any of the red flags. Is there anything else going on? We do know that, our breathing is very closely linked to our emotional responses. When we're having an argument, we go high and squeaky, and stuff like that. So if you're linked with, sensory changes, dysfunction, that's very anxiety provoking, all of that. So it's not so, it's to have that kind of very measured, objective overview, one by one, what's going on here, and working through what we can do, you can do to manage it. So it could be, is my answer. There are things that if it's linked more with the anxiety, and that, because there is very, very little people say that actually takes away that kind of MS hug kind of thing. And some people have said that, mindfulness, doing something they find relaxing, might not be mindfulness, can be helpful. And yes, it could be linked to, but you don't want to assume. So if you are worried, go and see a healthcare professional who knows you. See your nurse, your AHP, your allied health professional who knows you and your MS, just to try and work through what's going on with you right now, to work out, do we need to navigate you? Is it, because we always say don't blame everything on the MS, but we want to just make sure, how is that MS manifesting its symptoms and how I'm managing every day before you go firing off to other healthcare professionals. So yeah, it's a hard one to answer, but a good question to ask.
There was a few people asking about medications, and there was a few different medications popping up. Is there any of the sort of typical MS medications, could be DMTs or pain medications, that we know of that can cause issues with breathing?
So no, I mean, I'm not an MS expert, so the side effects of any medication will be explained. We always get questions about certain analgesics or certain drugs for neuropathic pain, say gabapentin, because all you have to do is put in Google and there might be some links to things like respiratory depression. But in terms of what we're aware of, especially with people who are on multiple medications, there's none that would have a direct side effect of breathlessness. It's more the interactions they have on each other. So whenever your MS team and your MS consultant will absolutely know the interactions of different drugs. So it's more if someone's wanting to start you on a drug that maybe doesn't know so much about your MS medications, it's definitely right to check. And, if you are given a medication for whatever reason and you're feeling new symptoms, then it's important you let someone know, even if it's your GP, because these things we report and we collect and we learn on. There are other things that I think are really important to maintain, like lung health, that maybe we haven't touched on, that are maybe more important than medications. So things like vaccinations, we talk about the influenza vaccination, there's the pneumococcal vaccination that people can have. Jody's talked about exercise and activity being really good for lung health, and I've mentioned smoking cessation or tobacco addiction, and that includes vapes now. Vapes are very dangerous, people. But where we're aware, some people use them as a stepping stool.
Yeah.
Nutrition. So nutrition, there's a really strong link to nutrition and chest infections and respiratory health, as well as some of the other medications that might help you if you have lots of saliva or you have really thick secretions. There are drugs called mucolytics, which can help break down the viscosity or the thickness of the phlegm. That can be started in addition to your MS medications that will help your respiratory health. So there is other medications or vaccinations that can help with your breathing. And we haven't mentioned reflux management, which a lot of people, if you find you get acid reflux or you get a lot of heartburn, that can be a side effect of some medications, but actually that can, and again, the speech and language therapists will talk more about this, but that can cause a high incidence of chest infections or saliva or this crackly kind of feeling people get. So reflux management is really important.
Yeah, if you're on a medication that's helping, for example, that you have found a medication that helps with the MS hug and it's successful, gabapentin, don't dramatically stop anything because you're worried that it, do seek advice from the specialist that knows you, the specialist that prescribed that medication. Because I find when you get that right blend of medical management for neuropathic medication, you don't want to mess with that. So if you notice some breathing problems, don't necessarily add up the dots in the wrong direction. Do speak to someone, because it could be completely unrelated. And sometimes people do kind of join up the wrong dots. So it is very individualized. I might read something on the internet that says, the link with, suppressing breathing and neurosuppressing drugs. So don't, and it could be that pain is helping management, is helping you breathe well, move well. So, just
stay away from Dr. Google.
Yeah.
This was the final question here, which I think popped up in the sleep podcast as well. Is there a best position to sleep or lay down for optimal breathing when living with MS?
The best position is the most comfortable position, number one.
Yeah.
Like I said, it can be if you experience different types of pain, we know that certain postures, if you have back pain, for example, lying on your side with your knees bent, with pillows in between can help. If you feel a little bit breathless, or you feel like you get more phlegm when you're lying flat, just a couple of pillows, or sleeping a bit more upright. But in terms of the best position for your lung health, there's not really a best position. It's the position of comfort. But like I said, if you do experience breathlessness and you have got a little bit of respiratory muscle weakness, definitely sleeping a bit propped up tends to be more comfortable. If you maybe struggle to get in certain positions, just a little pillow on your side, so you're in a kind of a slight left hand or right side lying helps as well. Jody, I don't know if you've got anything to add into that.
I'm only for my respiratory, that most of your lung tissues at the back of your body, so you're going to get the best breath exchange there. So I would say exactly a position that's comfortable, and be creative with how you might find that comfortable position, propping with pillows. Sometimes it's quite nice to have a session with. I'd say there is one key thing that I would add, actually, that I have learned. So particularly if you are struggling to get comfortable and you're finding it more difficult to support your torso, your limbs have got weaker, there are quite a lot of postural support cushions and systems that you can use. And I must admit, that surprisingly, they are designed to kind of hug your body. There are some that are made with really good responsive memory foam with Velcro. There's various different companies that do this now. So if you're if you are more wheelchair dependent, your limbs are a lot weaker, that has made a significant difference to how well someone can take a deep breath. Sorry, I just mean at the end. So do ask your healthcare professional to have a really good look at how you're lying in bed, and ask about postural support systems. That's a whole nother podcast we could do on postural support systems.
Are you volunteering yourself for that?
Yes, we can. So there is that special. So in addition to pillows, there are specialist postural support systems. So special pillows that will stay in place, that require a specialist assessment, and your neurophysio can help navigate you to how to go about that.
Can I just mention one thing on positioning as well, Helena? And one of the things that people ask us when they experience more breathlessness, is their sex, and their, how can they adopt positions of comfort during sex? And when we talk about sex, we don't just talk about sex, we talk about intimacy, because there's lots of different things that people can do. And the MS Trust have some amazing resources on this, so please check it out. But from a respiratory perspective, if we were advising people or giving people tips of how they can optimize their breathing during sex, side lying is something that people can find really helpful. If you are able to stand, and I think Jody mentioned this before, fixing with your upper limbs. So maybe using, if you have a desk or something like that in your bedroom or your house, and other positions of comfort as well. If the person with MS, if your partner doesn't have breathing conditions, maybe having more positions where they're on top can really help their breathlessness. Just be mindful of the diaphragm that sits just above the tummy area.
Yeah.
And you don't want to be compressing any of that. And also little things like propping your head up in the bed, or using pillows underneath your the upper part of your legs.
Yeah.
So underneath your bottom, between your knees, that can really help as well with just positions of breathing comfort. So I just wanted to mention that, but do look at the resources on the MS Trust website as well. And a final recommendation is the Asthma Lung UK website. Jody mentioned the singing groups before. They're open to anyone. So if you struggle to maybe find anything in your locality or with your MS service might provide, check out them, because there's some online groups as well, and they can have some great resources as well. You don't have to have COPD. You can go on. So another great charity as well. Thank you.
Oh, that's brilliant. We'll pop all these links in the show notes so people can find their way. And I'm hoping that everyone that's listening will go out and join a choir or a kazoo group or something.
Would it be helpful to put some links into some of the postural support systems?
I think that would be
Because
useful
I
as well.
think there might be other healthcare professionals, or someone can go and ask the healthcare professional. And they should be funded by your local health authority. I've managed to get funding for all of them. So they are expensive bits of kit, but they're worth looking at.
Oh, that sounds brilliant. Yes, send me all the links and I will put it in for the podcast, and people can go out and see what they can get to help them. But I just want to say thank you so much. This has been so interesting. I've learned so much. I never knew that there was so much to talk about when it comes to breathing. But for me, I think the takeaway seems to be that, you should take this serious, and preventative methods, just, start early before there is a problem.
Absolutely.
Definitely. Thank you so much.
Thank you.
Now, if this was a commercial podcast, here's where there would be an advert. But as you know, we're a charity, so we don't do that. So instead, we'd like to take this opportunity to tell you all about our fantastic resources for people with MS.
So where are you going to find those resources? The best place is on our website. So that's mstrust.org.uk. And there you can find lots and lots of information, resources for anyone who's affected by MS. So if you head to our website and you can type into the search bar breathing, you'll find links to lots of things that we've been discussing today, and also some breathing exercises as well. A blog actually written by Jody, who you've heard on our podcast today, where she has 5 top tips for improving your lung health, and that's the title of the blog as well. So please do go and have a look. And if you want any other information about MS, please do head to our website and make sure you have a good look around, because it is jam-packed on there, Helena, isn't it?
Oh yeah, there is something about everything, I would like. Well, that was again an awful lot of information, and I have to say, Nick, this is actually a subject I didn't know much about at all. I think, like you said in the start, it can be quite scary to talk about. I certainly knew, like during COVID times when everybody was talking a lot about problems with breathing and things like that, it used to really terrify me, knowing that maybe there is an issue for people with MS. So it actually helps to sort of normalize it, to talk about it, I think, and to sort of find out that there are some things we can try and do to prevent it as well. Because like they both said, that it tends to be the case that people end up in hospital before they actually realize that there was an issue to start with. And that could be a bit scary, can't it?
Really, yeah. I mean, it's good to know that there's some information out there and some advice. And I guess that would be something to take away, as if you're not sure, just, make sure you do go and see a health professional, because it's the type of thing, isn't it, that you don't want to leave, to by the wayside. If you're concerned, make sure you do go and see someone.
Yeah. And I think, the things they were saying about noticing sort of a difference, like if you're tying your shoelaces, you're suddenly realizing that you're getting a bit out of breath. And it's not just associated with sort of physical exertion, like, running for the bus or doing something, but actually just if you're just sitting still and you suddenly realize that you can't take a deep breath. Now, we did mention in the podcast as well about having things like MS hug or any kind of pain that can also stop you from taking a deep breath. So there's so many different little things that can affect it. So I think, to actually, if there is any part of this that kind of rings a bell or makes you think, I would get in touch with the MS nurse and sort of say, well, is there something we can do? Because like they talked about, there's things that you can be referred to, so you could measure these things. And just sort of see whether there is an issue and what can be done about it. But if you don't have any issues at all, then I think this is when we should really think about prevention. And sometimes it's really hard to get your head around thinking on these things. Because, I mean, it's a little bit like disease-modifying drugs, isn't it? Like, if I have a headache, I can take a paracetamol or ibuprofen or whatever preferred pill I like to try and get rid of my pain. But me taking a disease-modifying drug is not going to like change me in that from one state to another, but it's hopefully preventing me having relapses in the future. So sort of doing things like these breathing exercises that they were talking about, joining a singing group. I mean, it's fun stuff, isn't it? So it's not just necessarily like, oh, you need to go and sign up for a running thing or doing this exercise. It's actually stuff that could be quite fun, and it could be done at home. You could sit and do breathing exercises as you work, I suppose, or watch TV. So it's just important to try and remind yourself to do those things, and not just think, I'll deal with that when that problem occurs, because in this case, it's actually better to start early.
Yeah, it's the same with anything, isn't it, Helena? It's like, why should you eat a healthy diet? Why should you try and exercise when you can? Why should you? And it comes under it's that prevention, isn't it, that you're talking about, that the more that we can set ourselves up for our health, the better.
Yeah.
And singing wise, I'm not sure. My partner says I really can't sing, so I shall tell her that it's really important that I sing a lot from her. I quite like singing. And so when she's hearing my tone deaf notes, I'll remind her that it's really important for my health that I sing at home.
Yeah, there's a Swedish saying which is really quite tricky to translate, but it sort of goes a little bit like, I sing with passion rather than with skill. And I think that goes for me as well. It doesn't always sound great, but I'm enjoying it.
Yeah.
But, I think maybe we could have I don't know, should we start a kazoo club in the office? Maybe on the days we work from home might be better. But I do like the idea of like joining a singing group for maybe not great singers, but actually just meeting and singing together, rather than, I have to be so good, so I go and join a choir. And I think Jody was saying that they have these things at some of the therapy centers. So why not like check out what you got? Because if you enjoy singing, but you've always been told that you're not a great singer, it shouldn't really stop you, even if partners and children are not that encouraging. You just have to do it by yourself or with like-minded singers.
Yeah, and it's the social side of things as well that you were saying, Helena. It's something quite nice, isn't there, about coming together with other people? And if it's something that is going to benefit your health as well, it's that kind of like communal well-being element of that as well. So yeah, it's really nice.
Yeah, I agree. I think so. I would love to hear if people have done anything like this, if they joined any groups or if they've, I don't know, kazoo club. Please drop us a comment or send us a message, because I'd love to hear more about it.
Yeah, definitely. I think it's probably worth mentioning as well at this stage that breathing issues and MS, we're about to kind of come into autumn time as we're recording this. So we're heading towards, the times of potentially influenza. There's been some talk about COVID again, as well as lots of the germs that spring up this time of year, particularly with children going back to school. So I think it's good to know, just kind of have a think about chest infections that can be a cause and a result as well of breathing problems. Chest infections, as we know, can have serious impact on your quality of life. So a bit of advice is to minimize the chest infections where you can, is to practice that sort of general infection control. So making sure, you wash your hands, anti-back. If you can, the vaccinations for influenza and COVID. And just be alert of those sort of early signs of sickness or a cough. I'll always do this where I think, I'll just, soldier on, instead of taking that time off when, you can do, just to make sure that you're recovering. Tell your GP straight away. If you've listened to this and you think there's clearly links to MS and breathing problems, I've got a chest infection, get to your GP when you can. And you could also tell them that, also you could have that reduced lung function, and that you've had that information from the MS Trust and from Jody and Rachael.
Yeah, and as we say on the website, people with MS are entitled to get the flu vaccine. So in case your GP surgery hasn't got that on their notes, maybe to remind them of it. I know that I've fallen off a few times and I had to go and sort of say, no, I know I am under 65, but I am entitled to it. And generally it's just administration errors, but it could, if you haven't had a call or if you haven't had a note about it and you think you should be, then definitely get in touch with them. Another thing when we're talking about avoiding chest infection, and I think this is something I tell my kids daily, is to like really make sure you chew your food properly and like sit up straight when you eat, because there is such a thing like a type of pneumonia that can occur if food particles gets into the lungs. So yeah, to make sure that you actually chew your food and sit up straight. So all those kind of advice that your mum was telling you is probably worth thinking about. But we mentioned at the start as well, any kind of sudden onset of breathing difficulties or shortness of breath, you should still go and see a doctor or go to the A&E, because some of these things should be taken serious.
Yeah, it's so important, isn't it, Helena? And yeah, make sure you do go and see someone if you are in that position. But yeah, so I like that what you were saying there about sitting up straight, eating, chew your food, sit up straight, play your kazoo. My mum was always saying that, sit up straight, play your kazoo. That was the main message at my house.
Strange household.
But yeah, no, yeah, no, but yeah, and again, it's just that thing, isn't it? I'm terrible for that as well sometimes when I'm just not concentrating properly. I'll sit on the sofa, have something to eat, probably watching the so it's making sure you're concentrated on all of those things can be really beneficial.
Yeah. I think, talking with food in your mouth is obviously one of the other things I keep on saying to my kids, and they're probably always thinking, why shouldn't you be doing that? But I guess now I can tell them that you don't want to get pneumonia, do you?
Exactly. Yeah, so I think we just wanted to say before we end our podcast, if you enjoyed it and you're not familiar with what we do at the MS Trust, we're here for everyone affected by MS from the very first moment of diagnosis onwards. We're basically here to help you make sense of MS.
Yeah, and we're a charity, and we actually receive no funding from the government or the NHS. So this is just wholly due to the generosity of people like yourselves that might be listening and supporting us. So that's the only way we can sort of continue our mission. So if you would like to donate towards the work that we do here at the MS Trust, the link is mstrust.org.uk/donate, and it's very appreciated. So we can keep on talking about important issues.
Definitely. And the other thing that we do is we have a helpline. So if you have any questions about MS or anything else that you've heard about in our podcast, you can go ahead and give us a call. The number is 0800-032-3839, and the team is available between Monday to Friday, 9 a.m. to 5 p.m. Outside of these times, you can leave us a message as well, and we'll get back to you as soon as we can. Otherwise, you can also drop us an email for the helpline team. So that's ask@mstrust.org.uk. That number again, just in case, is 0800-032-3839.
And you can also talk to us on social media. We have a very vibrant Facebook group where the people who operate the inquiry line do drop in and answer questions as well. So if you just search for Multiple Sclerosis Trust, you'll find both the group and also a page on Facebook. We're also on YouTube, Twitter and Instagram, and also on Threads and on TikTok now, I believe. The list is getting longer and longer, isn't it? And I suppose Twitter is X now, isn't it? So I probably need to remember this. And you can find this podcast on Spotify, Google and Apple Podcast and Amazon Music, and probably a bunch of other places where your favorite podcasts pop up. So get in touch and like and subscribe, please. And now I think I'm off to sing to my children, whether they like it or not. So shall I see you for Kazoo Club next week?
Definitely. Thank you so much. Bye. Bye.
Bye.